Thousands of years before modern hospitals, anesthesia, or antibiotics, our ancestors were already performing surgeries that sound almost unbelievable today. They drilled into skulls, reconstructed noses, removed cataracts, and even created prosthetic body parts. These weren't crude experiments. In many cases, they were shockingly advanced, with techniques and tools that resemble what doctors still use today. This is the forgotten history of ancient surgery. The tools, the knowledge, and the genius of civilizations that dared to cut into the human body long before modern medicine was born. When most people think about ancient medicine, they picture superstition, herbs, and ritual chants. But the archaeological evidence tells a very different story. Across Egypt, India, Greece, Rome, and even prehistoric Europe, we find evidence that ancient doctors not only experimented with surgery, but also succeeded. They worked without anesthesia, without sterilization, without an understanding of germs. And yet, some patients survived procedures that would make even a modern surgeon hesitate. In this documentary, we'll explore 5 groundbreaking areas of ancient surgery, from trepanation, the world's oldest form of brain surgery, to Egyptian prosthetics, to the Indian physician Sushruta, who pioneered operations still used in plastic surgery today. Each example reveals a startling truth, that the origins of modern medicine run much deeper and much older than most of us realize. Number 1, trepanation. The oldest brain surgery. Trepanation, the act of cutting or drilling a hole into the human skull, is recognized as the oldest surgical procedure known to humankind. Archaeological evidence dates it back nearly 7,000 years, long before the emergence of cities, written records, or even the foundations of organized medicine. At first, the very idea sounds brutal, even barbaric. The thought of ancient people piercing into a living skull without anesthesia feels closer to torture than healing. Yet, discoveries made by archaeologists tell us a very different story, one that reveals not savagery, but astonishing medical insight. Across the world, from prehistoric Europe to the mountains of South America, from North Africa to Asia, excavations have revealed skulls with deliberate, carefully shaped holes cut into them. What is most remarkable is not just the presence of these holes, but the signs of bone regrowth around them. These were not fatal wounds left by violence. They were surgical procedures performed with skill, and in many cases, the patients lived long enough for their bodies to heal. In fact, some skulls show evidence that patients survived for years after undergoing the procedure. Why would ancient people risk such a dangerous act? Scholars still debate the answer. Some argue it was purely medical, a response to skull fractures and swelling caused by battle injuries or accidents. Removing a piece of bone could relieve pressure and save a life, not unlike modern craniotomies performed in hospitals today. Others suggest the practice was tied to conditions like epilepsy or mental illness. In cultures where seizures or hallucinations were explained as spiritual possession, opening the skull might have been seen as a way of releasing evil spirits. In some societies, trepanation even carried ritual significance. In the highlands of Peru, for example, trepanned skulls have been found in ceremonial contexts, suggesting the surgery may have had spiritual or social meaning. The tools used for this delicate work were as fascinating as the procedure itself. Early surgeons employed stone scrapers, grinding away bone layer by layer. Later cultures used obsidian, a volcanic glass sharper than modern surgical steel, which allowed for clean, precise incisions. By the Bronze and Iron Ages, more advanced instruments, metal drills and saws were in use, showing how surgical technology advanced alongside human civilization. What makes trepanation even more extraordinary is its global reach. This wasn't the discovery of a single culture. It appeared independently across continents. In France and Eastern Europe, Neolithic cemeteries hold hundreds of trepanned skulls. In Africa and Asia, similar evidence exists. And in Peru, archaeologists have uncovered skulls with multiple trepanations, meaning some patients underwent the procedure more than once and survived each time. Perhaps the most shocking revelation is not that trepanation existed, but that it often worked. Studies suggest survival rates as high as 70% in some regions, remarkable when compared to much later European surgeries in the Middle Ages, which often killed patients through infection. How did ancient people achieve this without anesthesia or sterile conditions? The answer may lie in methods we underestimate today. Alcohol, herbal sedatives, and hallucinogenic plants for pain relief. Obsidian blades that produced smoother, cleaner cuts than metal. And an extreme patience that meant scraping away bone slowly, rather than shattering it. Trepanation is often dismissed as primitive, but in truth, it represents one of humanity's first great medical achievements. It shows that early humans were not ignorant brutes, but innovators, people willing to take unimaginable risks to preserve life. Even today, neurosurgeons rely on the same principle when they cut into the skull to relieve brain swelling. The difference is that we now use sterile operating rooms and advanced imaging, while they used sharp stone and intuition. To look at a trepanned skull is to glimpse not just a medical act, but a story of resilience and courage, of patients who endured pain, of healers who dared to cut into the unknown, and of societies that believed healing could mean opening the very seat of human consciousness. Trepanation stands as a haunting reminder that the pursuit of medicine is as old as humanity itself, and that even in the distant past, people were already taking their first steps into the delicate world of surgery. Number 2. Egypt, surgical tools and prosthetics. Fast forward to ancient Egypt, where medicine and surgery reached a remarkably sophisticated level. Among the most important discoveries is the Edwin Smith Papyrus, a medical text dated around 1600 BC, but believed to be based on knowledge centuries older. Unlike many other ancient writings filled with magic spells and incantations, this papyrus is startlingly practical. It reads almost like a modern medical manual. The text describes detailed surgical cases, head wounds, broken bones, and dislocations, and even outlines step-by-step treatments. Terms like examine, diagnose, and treat appear repeatedly, suggesting Egyptian physicians were approaching medicine systematically, not just spiritually. For the first time in recorded history, healing was being described as a science of observation and intervention rather than a matter of pleasing the gods. Archaeologists have also uncovered actual surgical tools buried alongside physicians. Bronze scalpels, copper needles, probes, forceps, and cauterization instruments have all been found in tombs, many designed with shapes strikingly similar to modern surgical instruments. Their precision shows a mastery of metallurgy and an understanding of how specific tools could serve specific functions. But perhaps the most jaw-dropping discovery is prosthetics. In 2000, researchers studying a mummy in Luxor found a 3,000-year-old wooden toe attached with leather straps. At first, it was assumed to be decorative or symbolic, but closer examination revealed something far more extraordinary. The toe showed signs of wear, pressure points, and adjustments made to improve comfort and function. In other words, this wasn't an ornament, it was a working prosthetic device designed to help its wearer walk. The find is now considered the world's oldest known prosthetic, predating similar devices in Greece and Rome by centuries. Egyptian embalmers also provided an unexpected advantage. Through mummification, they dissected and preserved the human body, gaining a knowledge of internal organs that most other ancient cultures never had access to. While their focus was religious, This practice meant that Egyptian physicians had a unique anatomical awareness. They could recognize the locations of organs, the structure of the circulatory system, and the fragility of the human body in ways that informed their surgical practices. Taken together, these discoveries reveal a civilization that saw healing not as guesswork, but as a profession of skill, tools, and innovation. Ancient Egypt's contribution to surgery laid a foundation that would echo through the centuries. Number 3. Greece and Rome, pioneers of surgical instruments. When we think of medicine, one name always comes to mind: Hippocrates, the so-called father of medicine. Living in Greece between 460 and 370 BC, he documented surgical techniques for treating fractures, dislocations, and wounds. He emphasized careful observation, logical reasoning, and ethics, laying the foundation for modern medical practice. Instead of attributing every illness to angry gods, Hippocrates encouraged physicians to look at symptoms, track outcomes, and base treatment on what they could actually see. This was revolutionary thinking for the time, and it gave Greek surgeons a scientific framework that separated them from purely mystical healers. But the real leap came with the Romans, who took Greek knowledge and expanded it on an enormous scale. Roman military campaigns created endless demand for trauma surgery, as soldiers frequently suffered broken bones, deep cuts, and arrow wounds on the battlefield. Battlefield medicine forced doctors to innovate rapidly, and archaeological finds reveal they carried compact surgical kits with them wherever they went. These kits included scalpels, bone saws, forceps, clamps, and probes made of bronze and iron. Some were used for amputations when infection spread too far. Others were designed specifically to extract arrows or spearheads from flesh. Incredibly, archaeologists have also found gynecological instruments, including vaginal speculums, that look nearly identical to ones still in use today. One striking discovery was the cache of more than 150 surgical tools in the ruins of Pompeii, preserved perfectly by the eruption of Mount Vesuvius in 79 AD. These instruments demonstrate just how advanced Roman surgical technology had become, rivaling even some practices of the Middle Ages centuries later. The fact that they could craft such precise, specialized tools without modern machinery is a testament to Roman engineering and medical ambition. The Romans also developed valetudinaria, hospitals for soldiers, where patients could receive structured, specialized care rather than being treated haphazardly on the battlefield. These early hospitals were designed with wards, staff, and dedicated recovery areas, making them direct precursors to modern military hospitals. Of course, survival rates were inconsistent. Without anesthesia to dull pain or antiseptics to fight infection, operations were incredibly risky. But the precision of the tools, the organizational structure of care, and the boldness of the operations proved that ancient Greek and Roman surgery was anything but primitive. It was the bedrock upon which later medical revolutions would be built. Number 4. India, the legacy of Sushruta. Perhaps the greatest figure in ancient surgery was Sushruta, an Indian physician who lived around 600 BC. He is often called the father of surgery, and for good reason. His monumental text, the Sushruta Samhita, is one of the most comprehensive surgical manuals in history. Far more than just a medical record, it served as a textbook for generations of physicians, carefully outlining methods that were centuries ahead of their time. In this work, Sushruta describes over 300 surgical procedures and lists 120 surgical instruments, each with a specific function. Many of these instruments were modeled after the natural world, inspired by the beaks of birds, the claws of crabs, and the jaws of animals. This biomimicry gave them unique shapes, perfectly suited for cutting, clamping, probing, or stitching. His descriptions are so precise that modern surgeons can recognize their uses instantly, a testament to his astonishing foresight. One of his most famous contributions was rhinoplasty, or nose reconstruction surgery. In ancient India, cutting off the nose was sometimes used as a form of punishment or humiliation. To restore both dignity and function, Sushruta devised a brilliant method using a flap of skin from the patient's forehead to reconstruct the missing nose. Known today as the Indian flap, this technique became the very foundation of modern plastic surgery and is still referenced in surgical history. Sushruta also described cataract surgery, where he used a curved needle to dislodge the cloudy lens from the eye, allowing patients to regain partial sight. While crude by today's standards, the principles behind it mirror modern procedures remarkably closely. Beyond this, he detailed operations such as hernia repairs, bladder stone removal, wound stitching, and even early forms of dental surgery. His versatility demonstrated not only technical skill, but also a deep understanding of human anatomy. What is perhaps most astonishing is Sushruta's emphasis on hygiene. He recommended sterilizing surgical instruments with fire, boiling water, or alcohol, an idea that would not be fully embraced in the West until thousands of years later with the advent of germ theory. He also stressed the importance of diet, recovery, and exercise for patients, showing an appreciation for holistic care as much as technical surgery. The influence of his teachings spread far beyond India, reaching the Middle East and later Europe through translations and exchanges of knowledge. His surgical legacy bridged ancient and modern worlds, proving that medicine in India was not only advanced, but also global in its reach. In many ways, modern surgery owes just as much to Sushruta as it does to Hippocrates, making him a true pioneer of healing and human ingenuity. Number 5, the shock factor. Ancient versus modern. Looking at these civilizations side by side, one thing becomes clear. Ancient surgeons were far ahead of their time. The obsidian blades used in trepanation were sharper than modern scalpels. Egyptian prosthetics were not just cosmetic, but functional. Roman battlefield kits contained tools recognizable to modern doctors. And Sushruta's rhinoplasty technique is still in textbooks today. Of course, these surgeries were risky. Without anesthesia, patients often endured unimaginable pain. Without antibiotics, infection was a constant danger. Many patients didn't survive. But the fact that anyone survived at all is a testament to the skill and ingenuity of these early doctors. It also forces us to reconsider how we view history. We often assume that progress is linear, that people in the past were always less advanced than we are. But ancient surgery proves otherwise. In some cases, they discovered solutions that we only rediscovered centuries later. So, what do we take away from this story? That surgery, one of the pinnacles of modern medicine, is not just a product of science in the last few hundred years. It is a legacy stretching back thousands of years, built on trial, error, courage, and innovation. From Neolithic trepanation, to Egyptian prosthetics, to Roman battlefield kits, to the genius of Sushruta, ancient civilizations laid the groundwork for everything we know about surgery today. The next time you think of ancient people as primitive, remember this: they were cutting into the human body, repairing it, and sometimes even saving lives, long before modern science gave us anesthesia or antibiotics. Our ancestors were not just surviving. They were inventing, innovating, and pushing the boundaries of what was possible. This is the hidden story of ancient surgery, a story of risk, of brilliance, and of a kind of medical courage that shaped the future of humanity. And that is why these ancient tools, sharp, simple, and centuries ahead of their time, deserve to be remembered.